to select.
This is Purana Talk.
Hi, I'm Leon.
I'm Alan. We're the Purana guys. Never mind. Chapter 156 of the Garuda Purana, one of the 18 Mahapuranas. We're smack in the middle of it with a section straight out of an Ayurvedic medical text subtitled Diseases. Dhanvantari, the Lord of Ayurveda, speaks and says, O Sushruta, I shall explain the pathology of urshas, piles. Among the condylomatous growths, pin-like, it tells us, in the flesh, those that obstruct the anus are called urshas.
Okay, spell this word, urshas.
Well, it starts with ars, A-R-S, Shiva S, A-S. A-R, Shiva S, A-S. Shiva S is the S with the accent aigu. Urshas, piles. So, the deranged humor defiling the skin, flesh, and the fat makes many shoots of flesh of diverse shapes in the region of the rectum. They are called urshas. Piles. Tells us again. In brief, they are of two types. Sahaja, congenital, and anantarota, postnatal. So, you're born with or you get them later.
Right.
4. The passage of the rectum is 5.5 angulas long, and an angula, I think it's the width of a finger. We'll have to check that out. Google it. Passage of the rectum is 5.5 angulas long. There, dry stone-like lumps 3.5 angulas long grow. Blood vessels passing through the entrails come to these lumps and split open. Hence, within an angula from without, bleeding occurs in the region of these condylomatous growths. Hair, about 1.5 angulas in length, grow beyond them. In the congenital type of piles, the cause is the discomfort of the child in the womb.
Well, that's an odd idea.
Well,
let's blame mom. Yeah. Child wasn't comfortable.
I thought they were saying describing. Well, I thought they were saying maybe pregnant women got hemorrhoids.
Oh yeah, well that certainly happens. All right, that's very possible. Which one? 5?
5 to 6 stanzas. That's what these numbers are. We keep mentioning in case that hadn't been obvious. It's chapters divided into stanzas, which would have some poetic meter attached to them in the original language, but obliterated in translation. We ready? 7?
Yeah.
The creation of the seeds of piles is due to the misdeeds of the parents. There you go. Curse of gods also may be the cause. Yeah. If it's not the cause, it's the result. Yeah, you know.
Yep.
In the piles, due to the combined action of the doshas, it is the food taken in that creates the seeds. 8. All ailments congenital in nature are incurable.
If you were born with it, you're stuck with it.
That's what they're saying.
I don't believe it.
I don't believe it. The piles of congenital type are rough, ugly-looking, pointing inward, and pale yellow in color. The disorders brought about by them are dreadful.
Oh.
So
it's saying if you're born with intestinal problems, like around your anus,
you're going to have problems all your life.
Yeah.
we're sorry. We're all sorry. Piles are of 6 types. When caused by doshas after the birth, or I think that could be more like piles are of 6 types when caused by doshas after the birth. So not the congenital, but the postnatal, as they put it, ones. There's 6 types caused by doshas.
Okay.
The 3 different doshas severally or their combinations in twos make up the 6 varieties. There you go. As many ways as you can combine the 3 doshas is 6. I have to think about that for a moment, but it sounds believable. The dry piles are due to Vayu and Kapha.
In pairs, maybe.
In pairs, yes. 6 pairs. 1, 2, 3, 4, 5, 6. I think that's right.
Yeah, you've got 3 possibilities and 3 possibilities, so there's 6.
Okay.
See what I mean?
Sure.
Vada Pitta Kapha, 1 to 1. That's 1, and
right.
Then 1 to the 1 below it.
I was satisfied.
So see how you get 6 ways.
All right. I'm going to read this just because we lost the thread, and it's not very long. Piles are of 6 types when caused by doshas after birth. The 3 different doshas severally or their combinations in twos make up the 6 varieties. The dry piles are due to Vayu and Kapha, and the wet ones due to Pitta.
So dry are Vayu, which is
wind.
Wind. Yeah. God of wind.
And Kapha, which is mucus, and Pitta is the wet one.
But
it is sort of oily, hot, steamy. What? Kapha. Vayu and Kapha are the dry piles. And the wet ones are Pitta. Pitta the fool. That had to be said. Okay. 10. When more and more faces accumulate in the gastric fire that reduces the food taken before into, I think faces was feces.
Yeah.
When more and more feces accumulate, that could be disturbing.
Yeah.
In the feces, when more and more feces accumulate in the gastric fire that reduces the food taken before into feces, if the person indulges in excessive sexual intercourse, the doshas become aggravated.
I'm not quite sure what they're saying.
Badly translated.
But I think they're saying if you don't poop out as much as you create, that's a problem. That's what the first part of this is.
Okay.
But then it goes on to something else
and
talks about sexuality.
Well, let's read about 11 to 14 actually in a lump here. The Apana Vayu, genitourinary iliac nerve force, becomes aggravated due to various such causes as drinking in a fitful state, taking in hard indigestible foodstuffs, frequent rubbing of the belly, eyes, and throat with the palms, contact with very chill water, continuous riding for a long time, suppression of natural urges and evacuating them with difficulty, dysentery, constipation, pulling things, and in woman miscarriage and painful labor.
So I see this as all the different kinds of things that they think might cause it. Like originations or something like that.
Well, yeah. 15, 16. When the apana becomes excited, the feces gets obstructed in the flexus of the rectum and condylomatous growths occur in their knotty joints. Knotty.
Mm-hmm.
Its indications are low gastric function, obstruction to the removal of ordure, pain in the bones and calves of the legs, vertigo, burning sensation in the eyes, intumescence, and either loose motions or constipation. Obstructed from the front, the wind moves about below the umbilicus, and when the patient breathes with difficulty, it comes out with blood. 18. A rumbling sound in the entrails, eructation, profuse belching of saline stuff, excessive urination, scanty feces, non-inclination to take food, vertigo, sour taste in the mouth.
Yeah, it sounds like the person's getting sick from backup, basically. It's not coming out, so it's going back the other way.
19. Pain in the head, back and chest, lassitude, yearning for sensuous pleasures, anger due to frustration or neglect of service by others are also observed. 20. Sometimes the symptoms give rise to the suspicion of other ailments, such as diarrhea, wasting disease, jaundice, enlargement of the spleen, and dropsy. All these diseases increase when piles begin to grow. When the apana returns, it is obstructed by these growths, and so it aggravates other vital errors moving among the sense organs and parts of the whole body. 22. Then it produces a parched condition in the seats of pitta, kapha, urine, and feces, and obstructs the gastric fire. Then usually all the piles grow. Thanks for joining us this week.
We're sorry about the content, but we didn't write the book. We're just reading it.
It could be anything.
It could be anything. You never know. It's the ocean of wisdom. Big ocean.
And this is kind of a mucky end of it. The patient becomes lean, his enthusiasm and jolly spirit vanishes, he becomes dejected, emaciated, pallid in face, and appears like a worm-eaten tree, sapless and devoid of shade.
Oh, he's really sick.
It gets worse.
He's going to die, I think.
Long-term outlook. Anyway, 24 to 25, all the disorders mentioned in yakshma, pulmonary consumption, distress him. So all those things that were mentioned in that
in
section.
the heart section a couple days ago.
Suffers. They give rise to acute pain in the vulnerable joints, cough, excessive thirst, dryness in the mouth, dyspnea, catarrh, lassitude, aching pain in the limbs, nausea, sneezing, intumescence, fever, debility, deafness, rigidity, and the disease gravel. All these torment him. Completely emaciated, with voice broken, he sinks into a trance and frequently spits. He does not show any inclination to take food. He has pain in all joints, bones, chest, navel, anus, and the thigh joints. A kind of bilious matter begins to ooze out of the anus. It resembles water with which meat has been washed.
Bleeding, but liquid.
Yeah, I don't need it further. Well, this is a long section. It's your lucky day. Sorry. Some of the... Sorry. I'm back. 27. Some of these piles are dry, but others are found to suppurate and burst. They are caused by pitta and are of the color of turmeric. These piles generated by aggravated vayu are dry and rough. They are faded, reddish or brownish in color, and uneven. They are of unequal sizes and shapes, curved, sharp-pointed, with their external ends cracked and severed. They resemble the fruits of bimba karjura, karkandu, and karpasha seed. And you're lucky we have, actually, I can identify these plants. The bimba karjura is the Phoenix dactylifer, or P. acaulis. The karkandu is the Ziphus numeralia. And the karpasha is, of course, the Glossipia barbadens. But we're really just talking about the appearance of...
Yeah, they just look like these fruits.
things. Little versions.
Hopefully, yes.
Okay. Some of them resemble kadamba flowers, and some of the white mustard. Acute pain in the head, sides, shoulders, calves, thighs, thigh joints, etc. is felt. We're at 31 now. Sneezing, eructation, obstruction to the removal of ordure, catching pain in the heart, and non-relish for food, cough. Well, it says dyspnea this time, but I think it's dyspnea because it has been every other time. They just put an extra R in. Impaired function of the digestive system, ringing noise in the ear, and vertigo are further symptoms. 32. A patient distressed with these disorders passes stools with great difficulty. It is scanty. A loud sound is produced while evacuating the slimy, frothy stuff.
Dysentery is what they're describing now.
The skin, nail, feces, urine, eyes, and face are black in color. Chronic enlargement of the spleen, drooping, and globular tumors. Ashtila occur. Ashtila. The condylomatous growths of the piles due to the derangement of pitta are bluish in color at the opening and red, yellow, and black otherwise. They exude bloody, watery stuff through their small tips. They smell like raw meat. They are soft to the touch and hang loosely.
It's sad. Want to help.
Some of them resemble the tongue of a parrot, split liver, or the mouth of a leech. Burning sensation, fever and perspiration, thirst, epileptic fits, non-relish for food, and loss of sense are the symptoms at the time of suppuration. The feces are hot, liquid in form, bluish, reddish, and yellow in color, and undigested. The piles are thick in the middle like barley grain. The skin, nail, etc. are green or yellow in color. 37. If kapha be the cause, the piles are deep-rooted, thick, less painful, white in color, of decaying appearance, glossy, globular in shape, and unyielding. Lubricious, rigid, smooth, and mild, they produce an itching sensation, and the patient finds it pleasant to handle them and scratch them.
Well, we've seen that behavior.
Just don't. I don't know what you're going to say, but I just don't want to hear it. Doggy, maybe?
Mm-hmm.
Let's just say doggy. Some of them
Worms
are like...
can cause some of these symptoms, and also just the itching of them can drive you crazy too.
All right. Some of them are like the bamboo shoots, or the seed of the jackfruit, or the teat of a cow.
Seems like they may be confusing certain kinds of sexually transmitted disease too. Like
they would have to produce these are all little hangy downies that they've just taken a morbid fascination in the diversity of their. All right, let's
anal complaints. Really is what I think is what we should think.
Anal complaints. Yeah. All right.
So it's a whole complex of things.
Is that like vagina monologues?
Kind of like that. Yeah.
Okay, we're going to hurry this right along.
38.
No, I read 38. Okay. It begins with the word lubricious.
Oh, yes. I remember that.
39. There is catching pain in the thigh joints, rectum, bladder, and navel. Dyspnea, cough, disquietude in the cardiac region. Salivation, non-relish of food, and catarrh are the symptoms. 40. Strangury, difficulty in passing urine. Sluggishness of head, shivering, chilliness are experienced. Impotency, impaired gastric function, vomiting, and all the disorders in undigested state are also found in the patient. 41. The feces come out in profusion. They have the color of suet. They contain mucus cuppa matter. I'm sorry. It's not funny.
No, especially to somebody who has it.
The piles do not crack, nor do they bleed. Skin, etc., have gray color and are glossy. In the piles caused by the combined action of all doshas, all the symptoms can be observed. If they are caused by the impurity of blood, such symptoms as are in the pittaja type can be observed. The ja ending, it just implies born of, so born of pitta generated. 43. They resemble the shoots of vata or gunja berries or coral. The feces are hard and hot and contaminated. 44. If the motions are many, the blood gushes out suddenly. The skin of the patient is like that of a frog. He suffers all disorders due to the deficiency of blood. 45, 47. The patient loses the color of his complexion, strength, and mental gaiety. His vitality is impaired. His sense organs do not function properly. By taking hard foodstuffs, dehydrating the feces. Sorry, I just every now and then just the thought of this gory detail on and on. But okay, his sense organs do not function properly. By taking hard foodstuffs, dehydrating the feces like mudga, kodrava, jambira, bamboo shoots, Bengal gram, etc., the wind becomes aggravated in the region of the rectum and obstructs the ducts flowing down and dries up the waste matter.
So they've got a theory going of what's happening. You know, it's not probably very accurate.
So some of the things that are hard foodstuffs that would dehydrate the feces are mudga, which is Fasciolus radiatus.
Some more herb references.
I think that might be a lentil. The kodrava is Paspalum scribiculatum. SCREB, scribiculatum. And the final one, Jambira, says an allium species, so it's in the onion family. Or the lily family, but the lilies are in the onion family and garlic and all those good things. So, the wind becomes aggravated in the region of the rectum and obstructs the ducts flowing down and dries up the waste matter. 48. It absorbs the moisture of feces and urine and makes them thick with disastrous consequences. As a result of it, acute pain in the viscera, back, cardiac region, and the sides results. Tympanites, ascites, accumulation of feces, colic, pain in the bladder, and intumescence in the cheeks are likely to follow. The deranged vayu, taking an upward course, causes vomiting, non-relish for food and fever, palpitation of the heart, diarrhea, suppression of urine, and dysentery are also caused. 51. Deafness, dyspnea, acute headache, consumption, catarrh, fecal disorder, thirst, enlargement of the spleen, dropsy, etc. follow. Yeah, a lot of old-fashioned diseases back in those days.
Well, it's how they are referring to a bunch of diseases. We would think these are a whole bunch of diseases now.
Yeah. What's dropsy?
It was there's some discussion about what dropsy is. Some people think
Google
it's yeah, do, because it's interesting. Some people are thinking it's more like epilepsy, and other people think it's more like cancer.
All right. You be the judge. 52. All these caused by the derangement of vayu are terrific. I think that's
terrifying.
Terrific.
Not super good, like super scary.
Yes, we know. Piles bring about even death. Piles grow in the rectum of those patients whose viscera are attacked by vayu, even without the exciting factors. Could be boring. The congenital piles, as well as those that grow in the inner grove of the rectum, are incurable. If the digestive power is maintained, palliation is the only alternative. Growths of condylomatous nature caused by any two of the doshas in combination and those in the second flexus are incurable if left untreated for a year.
So if they can get away from you if you don't treat them right away.
Those piles that grow in the external groove. Before it was a grove. I thought, what?
Yeah, a groove is possible.
The inner grove of the rectum, it says there. I thought, like, that's in your man garden or what? Those piles that, or lady garden, those piles that grow in the external groove, as well as those caused by the single dosha, can be easily cured if they are of recent origin. Condylomatous growths are said to grow on the penis, etc., as well as in the navel too.
Maybe they're talking about genital warts or something.
Maybe. They are like the Gandupada, the pillow-footed worm or earthworm, and are lubricious and soft. Lubricious must mean lubricated, slimy, perhaps. 57. The wind Vyana, in combination with kapha, brings about growth of piles on the outer skin like nails, rough to the touch and firm. They are called karmakila. The roughness and piercing nature of the piles is due to vayu. The blackness at the top is due to pitta, and their glossiness, knotty nature, and coloration are due to kapha. An intelligent man must exert himself in quelling piles quickly, otherwise they may lead to graver disorders and ascites. Asitis. How would you pronounce it?
Yeah.
That's it.
That's that edition. Thanks for putting up with all the poop.
I think they left long ago. They turned off the